persons in isolation. What is the task force planning to do if the cases keep rising in order to keep persons isolated? And the next question is, with these new developments, will the Federation still be welcoming cruise ships in the next few weeks?
I spoke about the circuit breaker to contain or to halt the spread of the virus, and this is what we're doing over this next 2 weeks to decrease the movement of persons so that we can decrease the spread of the virus. The virus cannot move if people do not move, and so we are looking forward to a significant decrease in the numbers at the end of the 2 weeks. But we are calling upon individuals to take their personal responsibility seriously, because if you continue to move when you're not supposed to move, you can continue to spread the virus, and we will see the cases continuing to rise. And what we don't want to go to is what's called the nuclear option, where you have to have a complete and total lockdown. And so the control measures are in our hands. Also, once we continue to vaccinate persons, and we have a significant proportion of the persons vaccinated, that will stop the spread of the virus. I describe it as a speed bump in the road. If you have a speeding car that's coming and there's a speed bump there, it has to slow down. And so the speed bump are the persons who are vaccinated. The more vaccinated persons we have, the more speed bumps we have in the road, the virus or the speeding car will be forced to slow down and forced to stop. And so that's what we are doing now, making sure that we have sufficient persons vaccinated, so at the end of this 2-week period, we can all go out and obtain the benefits. And that's why we say getting vaccinated is an altruistic action. You're actually doing it not just for yourself, but you're doing it for other persons. And that is why we just can't focus and say we're going to do this just for the vaccinated persons. Yes, there are going to be some private events, etc., that vaccinated persons will be able to enter, and persons who are not vaccinated will have to step up to the plate to make sure that they can mingle in that setting. But for now, our overall objective is to look out for the entire country, both vaccinated and unvaccinated.
So at this time, we would welcome persons or entities who want to offer us the use of a number of rooms that we can place positive cases in terms of isolation and for quarantine. So that information, you could call the National COVID-19 Task Force and 311 and offer rooms. We are in need of rooms, and you could, provide us that offering. Thank you.
These are two, seem like very simple questions, but people want to know if they can sell their food down at the terminal And also if a tire repair shop is considered essential.
As indicated, all vendors, all street vendors, it's a reference to the person selling the food at the ferry terminal. If you do so as a vendor, you are not permitted to do so. Over the next 2 weeks. A tire repair shop, that is not in the list of essential services, and so that shop cannot operate. As I mentioned, if your business cannot operate remotely, then you are required to be closed. So a tire repair shop is not considered essential as defined by the regulation, and so you'll be required to be closed. Food vendors, you cannot operate on the streets.
Someone is inquiring, thank you, Superintendent, if we are considering getting the Pfizer vaccine so that children can be inoculated. And secondly, someone is also asking that if guests if the curfew time applies to guests who are staying in staycation at the hotels. My answer to that would be yes, but
Okay, I'll answer the last question first. In terms of the curfew, it's for everyone. Once you're on the Federation of St. Kitts and Nevis, please note that the inbound passengers who go to the hotels, they are in quarantine or they are vacation in place on the hotel property. And so they are confined, they remain in the confines of the hotel, so they don't really move. So they are already in quarantine at the hotel. In terms of vaccination for children, at present, ladies and gentlemen, we only have access to the AstraZeneca Oxford vaccine. It's offered to adults 18 years and over. Yes, it's now approved for children, and so if we do have access to the vaccine, yes, we can offer it to children, but at present we do not have access to the Pfizer, BioNTech, or the Moderna vaccine. Thanks.
The question with respect to the cruise ships, there's no answer to that as yet. There are some persons who are asking questions in terms of who is considered an essential worker. I think that the superintendent would have addressed that question. And it's in the SR&O, which I indicated earlier, and that can be found on the sknis.kn website, and also the COVID-19 19.gov.kn. So you can go there and you can get that information in terms of the regulations. I know sometimes we're too lazy to read, but I think it's important that we look at the regulation so that it would eliminate some of the questions that people are asking at this press conference. And if you read the regulations and you have a question, then I think that you can pose it here. There are people also asking about swimming and exercising, if those things will be allowed. Now, I think that too is in the regulations, and that they are allowed during the non-curfew hours. Of course, those things are allowed. There is a question that someone is asking about the persons who tested positive for COVID and haven't had a shot as yet, if they would be vaccinated then, or how are they treated?
Once someone tests positive for COVID-19, which means that they have the infection, they would have to recover. Now, after they recover, they would have some level of immunity, and the science has shown that that level of immunity might start to wane after 90 days, and so they can have their vaccination after they have recovered. But if vaccines are scarce, we would tend to give it to persons who have no protection at all and delay the vaccination in those persons who have recovered while they still have sufficient antibody levels to protect them. But once the person is fully recovered, they can have their vaccine.
Well, this one is for you. Someone is asking if fishers and farmers, as providers of food, are essential workers.
Well, we would always want to think of our agricultural workers as essential. Food is essential. And so, yes, our farmers and fishers, they could ply their trade limited time during the day. But yes, the farmers and fishers can ply their trade during the daytime.
Okay, this question keeps popping up all the time about breastfeeding. If breastfeeding mothers can take the vaccine.
We've had that question a number of times, and the answer is yes. So if you're breastfeeding, lactating, you are able to access the vaccine. So women who are breastfeeding, you can go and access the vaccine.
Okay. Thank you, Dr. Laws. This next question, why are persons who test positive for COVID-19 asked to stay at home as opposed to being in a controlled facility where they can be properly supervised by the medical professionals and security personnel? Has the government run out of space for isolation? The second one, are these persons' families given a list of suggestions of things they should do to take care of themselves or medication to help symptoms while isolating at home? And since several households are presently on mandatory self-quarantine or self-isolation, if students are allowed to continue their CSEC and CAPE examinations, how will the administration of the schools or the Ministry of Education know who should be in self-quarantine or self-isolation and should not be allowed on the school compound to do exams?
I'll deal with the first two questions. And so in terms of the positive cases, we have a number of the positive cases in COVID-19 certified facilities. We are in need of space, as I said a few minutes ago, and so we want it's an all of society approach, and so we are pleading to the society if there are rooms available that the government, that the Ministry of Health, the public health team can utilize and add to our room stock for isolation of cases. That would be very, very helpful at this time. And so in my COVID-19, my HEOC briefing, I spent considerable time explaining how individuals in households with positive cases can operate. Because ladies and gentlemen, you can dwell in a household with a positive case and not catch COVID. Yeah? And I was very careful in going through those recommendations. The Ministry of Health, we are going to develop a tile and we're going to distribute so, such that persons who have been diagnosed, it can help you, understand how you can spend the next couple of days and not pass on the infection to your relative or loved one. Thank you.
Good afternoon, Les Roy, and good afternoon to everyone. I think the question is what is to happen to CSEC and CAPE students. The Ministry of Education will make a proper announcement. We believe early in the new week as that would happen, as they have to make arrangements. But it would seem to be that this is an essential exercise for students, and whatever can be done to facilitate this, I'm sure the Ministry of Education will take the appropriate action.
Again, somebody is asking in terms of essential workers, if brokerage and shipping firms are considered essential. Superintendent.
All establishments outside the list that I mentioned earlier, they would be required to seek permission from the Commissioner of Police to operate during the next 2 weeks. So if you are a business other than a pharmacy, a supermarket, a bakery, those medical